This video will provide an overview on how to use the multipurpose distal pharyngeal airway, the McMurray Enhanced Airway, or MEA. The MEA is used by clinicians to perform 3 airway management functions. 1. Open the upper airway. 2. Deliver apneic oxygenation during intubation. And 3. Provide intraoral positive pressure ventilation. First, the MEA opens the upper airway beyond the base of the tongue to stent open the distal pharyngeal tissue. The MEA is placed orally between the molars to reduce gagging and risk of oral nasal injury. The MEA frees the clinician's hands to accomplish other important tasks, and the MEA is the only airway device that fits alongside an EGD bite block. Second, to deliver apneic oxygenation during the intubation process in patient populations prone to rapid desaturation, when presented with a difficult airway, or when an unanticipated difficult airway arises, slide the MEA to the left side of the mouth. Connect the MEA to the anesthesia circuit or manual resuscitator to deliver oxygen directly into the pharynx and intubate around the DPA. In sedation cases, the MEA also helps to lower the fire risk when attached to the circuit and following the fire risk protocol by minimizing FiO2, leader flow, and adjusting the APL. The MEA places the oxygen closer to the lungs, lowering the accumulation of oxygen around patient's face. Third, to facilitate intraoral ventilation, or IOV, clinicians have the option of doing so manually or with a mask. Let's take a closer look at how the MEA is used with intraoral ventilation. To provide IOV manually, place the MEA with the connector in the right corner of the lips. Connect the MEA to anesthesia circuit or manual resuscitator. Place the patient's chin in the clinician's left palm. Pinch nares closed with thumb and index finger. And finally, bring lips up to seal with palm. To provide IOV with a mask, align the MEA midline with MEA connector. Attach straight connector, not included, to MEA connector. Place straight connector through the mask's hole. Couple to manual resuscitator or anesthesia circuit. Provide positive pressure manual ventilation. Clinicians find that the MEA allows them to avoid challenging mask ventilations, especially with obese, OSA, edentulous, or bearded patients. IOV eases ventilation by placing the oxygen closer to the lungs and voiding leakage around the mask. Whenever using the MEA, it is important to place it correctly to improve success. First, size the MEA without the connector. Measure the distance from the philtrum to the tip of the earlobe. Second, assess readiness by looking for unresponsiveness to verbal stimuli and a slight chin lift indicating a negative gag reflex. Third, place the MEA curve facing the hard palate, align midline, and slide between the molars. If measured too long when sizing, withdraw until correctly placed. Keep some molars on bite block. No lubrication, rotation, or tongue depressor is needed. Confirm appropriate sizing and placement by observing rise and fall of the chest and monitoring end-tidal CO2 waveform and oxygen saturation. If unable to maintain oxygen saturation, resort to other airway options. Remove the MEA only after the patient's bite has been released on the MEA. The MEA can help in airway management in the following applications: post-op, ICU, ED, crash cart, EMS, police, fire, ambulance, medical facilities, doctor's offices, anesthesia for sedation or general cases. In summary, the MEA opens the distal pharyngeal airway to support spontaneous breathing, delivers apneic oxygenation during intubation, and decreases the fire risk in sedation cases, and provides intraoral ventilation to ease positive pressure mask ventilation. For potential complications and best practices, please refer to Instructions for Use insert, located in each MEA box or at McMurrayMed.com. Thank you for your interest in the MEA. This training video is to be used as a resource to build upon previous proper airway training. We are glad you share our desire to improve patient care, safety, and patient outcomes. For additional information, please reach us at McMurrayMed.com.